All right, joining us now on this same topic is Arkansas Attorney General Leslie Rutledge, one of the 20 attorneys general who filed the ObamaCare lawsuit. So where do you think this goes from here now?
Well, thank you, and good afternoon to you. Right now, this lawsuit, this was a big win for Americans to have this judge strike down the Affordable Care Act as unconstitutional. This came about because of the tax cuts that were made last year with President Trump and the Republican Congress, eliminating the tax penalty on the individual mandate, and therefore the entire Affordable Care Act is deemed unconstitutional. That individual mandate, that tax, is what the Supreme Court in NFIB versus Sebelius had originally hinged on. So what does this mean? This means that we've got appeals coming forward. This means that the American public does not need to panic right now because your health care plans are fine for the time being, but it's time for Congress to get to work, because while we want affordable health care, we want to take care of those with pre-existing conditions, we don't need to do so with a law that's unconstitutional, quite frankly.
So you want Congress to get back to work. If jurisdiction over health care came back to you in your state of Arkansas, what would you do differently that would make it better? How would you drive down costs? What specifically would you do?
Well, I think, first of all, we need to make sure that we have health care that does not force, as the Affordable Care Act did, to mandate and require people to buy insurance that they do not need or want. The entire Affordable Care Act was propped up on the idea that young, healthy people must be required to purchase health insurance. Again, we've got to take care of those with pre-existing conditions. But what we can't do is have laws that are unconstitutional. We have got to lower the cost. And I agree with the Republican Congressman.
Yes. How do you lower the cost? Because you're talking about taking away those who are paying, who are the healthy people that were paying into the system, and it wasn't fair to place a tax on them. So then you're still stuck with really expensive health care. How do you bring down the cost?
Absolutely. Well, I think having conversations with the insurance companies, having conversations with medical providers, those with the technology, and saying, how do we lower these costs? Everything that we see, whether it's a digital television that's 75 inches that's hanging on your wall, a few years ago, that thing may have been $2,000 or $3,000. Now it's under $1,000. So every bit of technology we are able to lower the cost on, except for healthcare, which is skyrocketing out of control, providing prescription drug medications. Again, those medications skyrocketing out of control for people not able to afford them, particularly people on fixed incomes, whether it's our senior citizens who need the most health care.
Well, Madam Attorney General, let me stop you right there before we run out of time, because the problem with those drug costs, you look at something like Lipitor, which is listed at $1,400, and you find out that the only people that are paying that are the government through taxpayers when somebody on Medicare goes into the hospital. For regular people who have a brain in their head, they're paying $20 for it when, they get the off-label brand or they buy it through insurance. In other words, the reason why prices are so high is because the government is using taxpayer dollars to pay it in these weird situations like in the hospital.
That's right. One of the areas that we work on and I work on is Medicaid fraud control and prevention. And we are looking at costs, for example, of prescription medications through our pharmacy benefit managers, what they are charging our local pharmacies here in Arkansas. We've opened up an investigation into one of the pharmacy benefit managers, and the prescription drug cost is one of the most expensive costs for Americans.
I'm not sure it's fraud. I think it might be just government stupidity where they're paying into Medicare. But
I'm certainly not arguing that that doesn't exist.
Madam Attorney General, thank you for joining us. We appreciate it.